What are the different types of breast augs? So I divide them up into two categories. One is the implant base, which is usually a saline or silicone breast implant, and the second is a fat grafting procedure. What are the different types of implants? There are saline and there are silicone implants. What are the differences between saline and silicone implants? The difference is what they're filled with. So saline are basically silicone shells filled with salt water. Silicone implants are silicone shells filled with silicone. Why would you pick one versus the other? So why saline? Why silicone? One of the advantages of saline is that if you do have a rupture, you know right away. It's just saline that falls out into your body. You go flat and you don't have to worry about any particular screening or anything like that. One of the advantages of silicone, on the other hand, is you have decreased rippling typically. You have a more stable implant. However, it does require some screening, typically at around 6 years after your breast augmentation, and then every 2 to 3 years after that with either a MRI or high resolution ultrasound per the FDA recommendations. Should you have your implant placed under or on top of the muscle? It's really up to personal preference. One of the advantages of going on top of the muscle is you leave the muscle alone, you're not injuring the muscle, you're not cutting the muscle, so theoretically your function is intact and you have increased strength even after surgery. The other advantage when you don't cut the muscle is you don't get the animation deformity, such as when you flex, you don't have that cut through the middle of your implant, which some women find very disturbing. What's the advantage of going below the muscle? You have the muscle on top of the implant, covering that top third, and that can help hide the transition from your upper chest to the implant, so it can smooth that transition. Historically as well, there is a decreased risk of capsular contracture with implants placed under the muscle, though some current evidence is suggesting that may be due to previous studies and the way they looked at the data. And the actual incidence of capsular contracture on top of the muscle is far lower than we thought previously. Why would you pick fat grafting instead of implants? Some people really don't want an implant. Fat grafting is your own body. You don't have to worry about a silicone implant or saline implant. It's your fat. We harvest it from somewhere else on your body, and then we inject it back into your breast. So it gives us some customization of where we inject it, where the volume goes. However, if you're looking to really increase your volume, you typically need to go with an implant.